Are your energy levels low? Feel like you're dragging yourself throughout the day? This is a very common sign that something might be wrong with your thyroid. But what happens when you visit your doctor and after many tests, there's nothing wrong with your thyroid? So, this is a very common complaint among people we see who have adrenal fatigue. And we like to discuss this issue with you today. This is a Dr. Lam show where we talk about integrative medicine and share it with you to empower you to take control of your health. I'm Dr. Carrie Lam, and I want to encourage you to use holistic strategies combined with conventional medicine to find better health.
And I'm Dr. Jeremy Lam. I've spent years helping alleviate chronic disease by also helping to use alternative and holistic strategies as well as conventional medicine. And so we're here to empower you to take control of your health and your life. So if you enjoy the Dr. Lam show, please like it and share it with your friends. We want to help as many people as possible to enjoy better adrenal health through gentle and natural strategies. So first of all, let's clear up a common question that a lot of people have. Thyroid or adrenals, which could be causing your low energy levels? Now, some people might have a thyroid issue and some other people might have adrenal issues, or it can be that a person could have both. And so it's quite confusing, and it's one of the most challenging aspects that we deal with in our work because most people don't understand the compartmentalized approach to your health, right? So when you have a thyroid issue, you're referred to an endocrinologist. And when you have a adrenal issue, you're referred to another specialist as well. But it's important to kind of take a look at your whole body and how the each organ systems kind of correlate with each other and how it can actually connect with each other. So, Dr. Carey, how are the thyroid and the adrenals connected?
So, like you said, there's a lot of similarities in the symptoms that could come up when someone has thyroid issues and when someone has adrenal issues. It can be fatigue, it can be weight gain, it can be hair loss, um, and it could be just gaining weight and not being able to have it come off. It could be hormone imbalance. And there's a lot of similarities. And one way that you can tell is by doing labs. But even so, sometimes the labs might not be enough. So if you were to go to your doctor with fatigue, one of the tests that they would run would be, yes, maybe a thyroid panel. And either it's going to come back positive or it's going to come back normal. We see both also that come out, right? So you have your TSH done, the T3 to free T3 to free T4, maybe an anemia panel, make sure you're normal. And what might come back is that you either have some subclinical uh, hypothyroid, where when you're hypothyroid, meaning you have lower thyroid function, or Hashimoto's when your antibodies are elevated, then they diagnose you with, all right, hypothyroid causing your fatigue. But they didn't really actually look to see if you have underlying adrenal problems in addition, right? Someone can have thyroid problems, but they could also have adrenal problems underlying. And if you don't address the underlying adrenal problems, then you get placed on thyroid medication. And at first, you might feel good. You might feel more energy. Hey, it's stimulating my metabolism. I have more energy to do what I want to do. But after a few months, you might find yourself starting to get a little more tired again, back to your baseline of what you were previously, because you did not really get to the root cause, which could have been an adrenal issue. So it's important to not only when you have, fatigue, not only to look at the thyroid, but also the adrenals and also the other parts of your body that could be causing the fatigue, right, Dr. Jeremy?
Yeah, you're correct. And oftentimes, also in a lot of our patients, we find that they have to keep going up on their thyroid medication dosing because, again, that's just a band-aid that you're using. And so each time you put a stronger band-aid on and a stronger band-aid on, hoping that it would solve the problem. But oftentimes it does not. And so that's why, we see a lot of people on much higher doses of thyroid medication, and yet they're still feeling very slumpy, very fatigued, having brain fog. And that's because they're not addressing the underlying problem, right? And so, the adrenals and the thyroid is connected because there's something called the ovarian adrenal thyroid axis. And so, the HPA axis, which is the hypothalamus pituitary, and the adrenal axis is also what helps your body deal with stress. And so, similar along those lines is also, like I mentioned, the OAT, or the ovarian adrenal thyroid axis, where if one of the organ systems is not functioning properly, then that's directly going to affect the other organ systems. So if you have adrenals that's not working, then your thyroid is going to affect it, same as well as it's going to affect your ovarian system. So people with thyroid issues can have many other different organs that are affected as well and have imbalances. And I
Mhm.
like to think of it, almost as if you have a stool with three legs, and if one leg is not well balanced, then it's almost impossible to sit very comfortably because it's not balanced,
Mhm.
right? And
Yeah.
so, is it your adrenals or your thyroid that's causing the problems that you're experiencing, or could it be both? If your
Mhm.
energy is low for a long time and nothing you do seems to help, make sure that you've done a checkup with your doctor first, and make sure you're running the appropriate tests to make sure that you have reasons for your low energy levels. And if nothing shows up on the labs and you've done everything that you can, then maybe you need to look some more at the thyroid or the adrenals as the underlying root problem.
Right.
And that's why we're here at the Dr. Lam Show, is to help you try to figure that out.
And it's very important to ask why. Why are the thyroid and the adrenals so closely related? It's because when your body undergoes chronic stress, it begins to shut down some of the processes in order to conserve energy. So there's production of T3 and T4, right? So T4 and T3 are the hormones that are made in your thyroid. They're thyroid hormones. T4 is a prohormone and it converts to T3, which is actually the part of the thyroid that is active. So, but your body produces 4 times as much T4 than T3, but the T3 is actually 4 times more powerful as it's actually active and making the metabolism happen. And your body only contains receptors for T3. So it's interesting that a lot of conventional medications, Synthroid is actually T4, in the hopes that it will in your body convert to T3, but it's actually not the active form that your body uses, right? And so when your body undergoes stress, it doesn't want to produce more T3 and T4. It's trying to conserve energy rather than burn the energy up. And so your body also produces this thing called thyroid binding globulin. And thyroid binding globulin allows your thyroid hormones to be more bound and therefore unavailable for your cells to be used. And that's why you might see lower free T4 and lower free T3 levels
Mm,
when you do the lab
yeah.
tests. But the total T4 and the T3 might actually be normal, except that your thyroid binding globulin is elevated, and therefore it lowers the free and active form of the T4 and the T3. In addition, we always like to check also the reverse T3, right? And reverse T3, you can think of it more of like a braking mechanism to oppose the function of the active T3. And so cortisol inhibits the conversion from T4 into T3. And instead, it wants to make reverse T3 to slow your body down. So that's another lab that can be used in order to see, hey, is my body slowing down? And why is it not converting to regular T3, right? And so it's important to see what labs are being done and what the reason is that stress affects your thyroid.
And so, if you want assistance with interpreting these labs, or also if you find that you might need more of these specialized thyroid labs, you can, give our team a call at 714-709-8000 to really get support for your thyroid and also for your adrenals.
Make sure you like and subscribe to our YouTube channel also. So, Dr. Jeremy, what if someone comes in saying that they're on thyroid medication, but they don't feel good on it? They're still feeling the fatigue, the weight gain, the hair loss. What
So
would you do?
like, yeah, so like you had mentioned, right, I would make sure that the thyroid is fully optimized with their free T3, free T4, reverse T3, as well as making sure their antibodies are also worked on. And if all that is really optimal, then the next step that I would proceed to is look at the adrenals, right, by doing a saliva cortisol test to see where their adrenals are function is at and see how bad the adrenal fatigue is. Now, oftentimes we're able to help the thyroid and help patients come down on the thyroid medication if we address the underlying root problem, which is the adrenals. And so, like Dr. Carey, you had mentioned before, that the thyroid medication is sometimes put as a band-aid, and that's because when you do have adrenal fatigue, it's telling your thyroid to, hey, I need to slow down, so therefore I'm going to decrease making my thyroid hormone. So when we do help out with the adrenals, then we're able to sometimes lower the thyroid medication dosing, and you're still feeling better instead of feeling worse from decreasing that thyroid medication. So it's really helping the stress response and helping your adrenals be able to handle and adapt to the stress that's going on.
Yeah, you're right. A lot of doctors do want to just try to get your numbers on the free T3 and the free T4 so optimized, and that they actually keep giving thyroid medication, keep giving thyroid medication in order to get those numbers up, rather than listening to the body saying, hey, I'm starting to get palpitations, I'm starting to not feel kind of anxious and wired and jittery. Those are signs that you might be having too much thyroid on board. And it could be a sign that you need to start pulling back and looking at what else could be the issues, right? So, how does someone reduce stress when we are thinking and talking about the adrenals, Dr. Jeremy?
Well, someone can reduce stress by, just taking lifestyle measures, right? So knowing when to say no, also taking frequent breaks, meditating, doing some adrenal breathing exercises. Other things to help with stress is all making sure that what you're going into your diet and what goes into your body is very clean, very organic, and not stressing out your body as much.
Hmm.
Regarding supplementation, we go through this quite in depth, but in general, there's quite a bit of supplements that can help with adrenal fatigue as well. But you do want to be careful when you're approaching this because there are a lot of hormones and a lot of different factors in play, especially when you're dealing with thyroid and adrenal issues as well. So it's not a one size fits all approach. And it's also depending on where you are at your recovery stage. So that's why
Hmm.
it's very important to work with a practitioner who knows what your body is experiencing and when to lead you to go through these things to make sure that you're getting your levels checked at the right time, to making sure that you're taking the right supplementation to only support your thyroid, to support your adrenals, or to support both, right?
Right.
And making sure that the supplementation is also at the right dosing.
Right. And sometimes people they don't know that there's so many different choices, even for thyroid medication, right? Maybe we can go through some of that. So one of the most well-known is Synthroid or levothyroxine, which is basically just T4, like we said, and that's the non-active form of thyroid. The other conventional medication that if you go to an endocrinologist, they might be able to give you also is called liothyronine, which is T3, or like the brand name is Cytomel. And so usually they would do a combination between T4 and T3 to make sure both are being um, adequately dosed. And there are even more other options, like more natural options. Dr. Jeremy, can you go into those?
Well, you could take thyroid glandulars. That's one option as well. Oftentimes, there's more natural desiccated thyroid, such as armored thyroid, nature thyroid, or MP thyroid as well. And those are a combination of T4 and T3 as well. But oftentimes, if you do have Hashimoto's or if you have antibodies that are positive, taking those medications also might not be the right step for you. And then lastly, we also work with compounded pharmacists and compounding pharmacies where you can get compounded thyroid medication as well to really get your levels optimized and to get you to be at the right levels. But again, this is all person to person based and it's not really a one size fit all. And again, we're just talking about thyroid, but remember that we said in the beginning that you have to also support your adrenal health to get your thyroid back on track.
Right. So make sure you're getting the right kind of help to help alleviate your fatigue, your weight gain. And if you are having a thyroid problem, definitely see the doctor because you do want to do regular blood work, even if you're making any medication changes or any supplement changes. You always want to do it with a practitioner's guidance, right? And so if you want help with your thyroid or with your adrenals, just definitely give our office a call, 714-709-8000 for a free initial phone call. We'll see if you're right fit for our program because we help people with thyroid issues all the time. And not only thyroid issues, but adrenal issues and the hormone balancing. And we look at the whole body as the thyroid is only one little organ in your whole body. And you want to make sure that you're definitely getting a good neuroendometabolic stress response look to your whole system. Okay, so if you've enjoyed the show about the thyroid, we ask that you remember to subscribe and like it and share it, as it really helps other people find us where they can also get their help as we reach a wider audience. So thank you for watching the Dr. Lam Show. We're here to empower you to take control of your health.